Airborne precautions. What if a single breath could spread a dangerous infection? Some diseases travel through tiny airborne particles that can remain suspended in the air and infect others from a distance. That's why understanding airborne precautions is a critical skill for every healthcare professional. In this video, we'll break down everything you need to know, from the diseases that require airborne isolation to the correct personal protective equipment and essential nursing responsibilities. Let's start. Airborne precautions are infection prevention measures used to prevent the transmission of infectious diseases that spread through tiny airborne particles, which can remain suspended in the air and be inhaled by others over time and distance. There are 7 diseases commonly requiring airborne precautions. You can use this list: tuberculosis, measles, chickenpox, disseminated herpes zoster, COVID-19, according to many healthcare facility policies and especially during aerosol-generating procedures. Severe acute respiratory syndrome, Middle East respiratory syndrome. The following precautions are required for patients on airborne precautions. Place the patient in an airborne infection isolation room. Keep the room door closed at all times. Wear a fit-tested N95 respirator before entering the room. Perform hand hygiene before and after patient contact. Wear gloves if contact with blood, body fluids, secretions, excretions, or contaminated items is anticipated. Wear a gown if there is a risk of clothing contamination. Wear eye protection if there is a risk of splashes or sprays. Limit patient transport outside the room. Place a surgical mask on the patient if transport is necessary. Use dedicated or disposable patient care equipment whenever possible. Clean and disinfect equipment and environmental surfaces according to facility policy. These measures help prevent the spread of infections transmitted through tiny airborne particles.